Since the quake was reported, VA has moved quickly to identify people and material that could be made available to assist. Hundreds of VA staff with medical and technical skills maintain their readiness to deploy to areas hit by natural disaster or other emergencies. Because of the international nature of this crisis, language facility, passport, and vaccination status are added criteria. In addition to a handful of veterans and dependents receiving benefits from VA, a number of staff members also have family connections there. In addition to preparing medical teams to deploy, the VA Caribbean healthcare system in San Juan, Puerto Rico, loaded 12 containers of medical supplies to be airlifted to Haiti. The containers included basic medical supplies, oxygen tanks, and pharmaceuticals, and came from various VA medical facilities in Florida and San Juan. VA worked in close coordination with the U.S. Southern Command, the Army Reserve, and the Puerto Rico Army National Guard to get the items to an Argentinian medical team in Haiti. Dr. Paul Kim, VA's Director of Planning and National Security Service, said VA's disaster emergency medical personnel system is ready to respond.
VA has had truly an integrated response to the disaster in Haiti. The Integrated Operations Center is the fusion center for all information that either comes into VA or we send out to our federal partners. And they have their finger on the pulse of not only this disaster, but anything that may impact the department as a whole. One of the initial efforts was by VHA. VHA maintains a database which is called the Disaster Emergency Medical Personnel System. Once they heard of what was going on in country, they scrubbed the database and looked for clinicians that would be suited for this type of response. They identified over 100 people who speak French, those who speak Creole, and they've been on a waiting list, prepared to go at any time.